When Buffalo Bills player Damar Hamlin collapsed suddenly on the field during Monday Night Football, millions of people watched in shock and confusion. The terrifying moment sparked nationwide conversations about the difference between a heart attack and sudden cardiac arrest. At first glance, the two terms sound similar, and many people use them interchangeably. But in reality, they describe very different events inside the body events with distinct causes, treatments, and outcomes. Understanding these differences is not just important for medical professionals, it is something every person should know, because recognizing the warning signs and responding quickly can mean the difference between life and death. So let's begin by separating the two conditions. A sudden cardiac arrest occurs when the heart's electrical system malfunctions. Instead of beating in a strong coordinated rhythm, the heart falls into chaos, often quivering or stopping altogether. This disruption, called an arrhythmia, means blood is no longer pumped to the brain or the rest of the body. Within seconds, the person collapses, becomes unresponsive, and if untreated, will die within minutes. Cardiac arrest is therefore an electrical problem. It is the wiring of the heart going haywire. A heart attack, on the other hand, is a circulation problem. In this situation, blood cannot flow properly through the coronary arteries, the vessels that supply oxygen-rich blood to the heart muscle itself. Without oxygen, parts of the heart tissue begin to die. The blockage that causes this lack of blood flow usually comes from a blood clot forming on top of fatty plaque that is built up in the artery over time. This buildup is known as atherosclerosis. It consists of cholesterol, fats, calcium, and other materials that gradually narrow the arteries. When that plaque ruptures, the body tries to heal the rupture by forming a clot, but in doing so completely blocks the artery. Suddenly, oxygen is cut off to part of the heart muscle, and a heart attack begins. The symptoms of these two conditions also differ. During a heart attack, a person may feel chest pain or discomfort, often described as pressure, tightness, or a squeezing sensation. The pain might spread to the arms, neck, jaw, or back. They may experience shortness of breath, nausea, sweating, or lightheadedness. These symptoms can develop gradually and may last for minutes or even hours. In contrast, cardiac arrest strikes abruptly and dramatically. One moment, a person might be talking or even running on a football field, and the next they collapse without warning, lose consciousness, and stop breathing. This sudden nature makes cardiac arrest particularly frightening and deadly. Now, what causes these problems? For heart attacks, we return to the idea of atherosclerosis. Over years of poor diet, smoking, high blood pressure, diabetes, and obesity, the arteries become clogged with fatty deposits. Lifestyle factors like smoking not only damage the artery walls, but also make the blood more prone to clotting. High blood pressure puts constant stress on the vessels, while diabetes alters how the body processes fats and sugars, leading to more plaque buildup. Obesity adds yet another layer of risk, often bringing with it a combination of high cholesterol, insulin resistance, and elevated blood pressure. In some cases, a heart attack may also result from a sudden spasm of a coronary artery. This spasm squeezes the artery so tightly that blood flow is reduced or stopped altogether. This is most often seen in people with a history of coronary artery disease, but it can also occur unexpectedly. Cardiac arrest, by contrast, is less about blocked arteries and more about faulty signals. The heart's rhythm is controlled by an intricate electrical system. If that system malfunctions, the rhythm may become dangerously fast, chaotic, or stop entirely. Conditions like ventricular fibrillation or ventricular tachycardia are the most common electrical disturbances that cause cardiac arrest. Sometimes a severe heart attack triggers cardiac arrest, but it can also happen without any warning or obvious underlying heart disease. Athletes like Damar Hamlin may experience it due to a rare impact-related arrhythmia, while others may be born with genetic conditions that predispose them to electrical instability. Cardiomyopathy, which is a disease of the heart muscle, can also set the stage for sudden cardiac arrest. The outcomes of these two emergencies depend heavily on immediate action. In the case of a heart attack, time is muscle. The longer the blockage goes untreated, the more heart muscle dies. That is why doctors emphasize calling emergency services right away if you suspect a heart attack. Emergency medical professionals can provide oxygen, medications to prevent clotting, and even perform life-saving interventions en route to the hospital. At the hospital, treatments may include blood thinners, clot-busting drugs, angioplasty to open the artery with a balloon, or the placement of stents to keep the artery open. In severe cases, bypass surgery may be required to reroute blood around the blockage. With cardiac arrest, the urgency is even greater. Without a heartbeat, the brain begins to die within 4 to 6 minutes. Survival depends almost entirely on immediate CPR and defibrillation. Chest compressions keep blood circulating to vital organs, buying time until the heart can be shocked back into a normal rhythm. Automated external defibrillators, or AEDs, are designed to deliver this life-saving shock and can often be found in airports, gyms, schools, and stadiums. The survival rate of out-of-hospital cardiac arrest in the United States remains grim. Of more than 356,000 cases each year, nearly 90% are fatal. This makes bystander CPR one of the most powerful tools available because every minute without intervention drastically lowers the chance of survival. The story of Damar Hamlin is a rare and hopeful example. Immediate medical response on the field, including CPR and defibrillation, saved his life. His collapse highlighted the importance of preparation, training, and public awareness. If someone near you suddenly collapses, stops breathing, and has no pulse, starting CPR immediately can double or triple their chances of survival. That is why the American Heart Association encourages everyone, at least one person in every household, to learn CPR. It is not only a skill for healthcare professionals, it is a skill for ordinary people who may one day become heroes simply because they acted quickly. Beyond emergency response, we should also focus on prevention. For heart attacks, lifestyle changes make a tremendous difference. Eating a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats can help reduce cholesterol levels and keep arteries clear. Regular physical activity strengthens the heart and helps control blood pressure, blood sugar, and weight. Avoiding smoking, limiting alcohol, and managing stress are equally vital. For those at high risk, regular checkups, cholesterol monitoring, and blood pressure control can prevent plaque buildup from turning into a life-threatening blockage. Prevention of cardiac arrest can be more challenging because it often strikes without warning. However, managing underlying conditions like heart failure, arrhythmias, or cardiomyopathy is essential. Medications, implantable defibrillators, or surgical procedures may be recommended for those at risk. Family history also plays a role, and genetic counseling may be appropriate in some cases. Again, awareness and preparedness are critical. Knowing CPR, recognizing warning signs, and having AEDs available in public spaces provide the safety net needed when the unexpected occurs. When we put this all together, the key takeaway is clear. A heart attack and a cardiac arrest are not the same, but they are connected. A heart attack can sometimes trigger cardiac arrest, yet cardiac arrest can also happen independently. Both are medical emergencies, both demand swift action, and both remind us of the fragility of life and the power of preparedness. So the next time you hear someone use the terms interchangeably, you can share the truth. A heart attack is a circulation problem, while cardiac arrest is an electrical problem. One starves the heart muscle of oxygen, the other stops the heartbeat altogether. Knowing the difference might help you save a life.